And thank you all for having this hearing again. It's just so incredible to see our government at work, especially at the state level. And it's really an honor and a privilege to be able to just share with you a few minutes about my perspective of House Bill or House Joint Resolution 2. As we've already said, my name is Bill Geraci. I own an insurance agency in Sunbury, and that's in House District 61. I specialize in selling health insurance to employers, and I've been doing that for 24 years, selling health insurance. So as I say in my paper, when I sit down with an employer, especially at this time of the year, because this is the time when most employers are renewing their health insurance, January the 1st. So the last quarter of the year, I'm constantly meeting with employers about their health insurance and the cost of it. And again, these are employers that are providing benefits to their employees. And when I'm sitting in that room going through the proposals and the ideas and strategies, always kind of behind my shoulder is the ghost of Washington, D.C. And as I say here, they're silent, they're invisible, and expensive. Now, this is a crazy number, but I say that about 15% of the premium for an employer is spent in federal regulations to, as I say in the below, we've got 4 federal departments that are constantly passing regulations and asking for fees and things like that. And so about 15%, so if you were looking at a small employer that had 50 employees, they'd be easily spending $500,000 a year on their benefits. And I don't know if you see the trend in health insurance, but right now they're predicting that the premiums on the Affordable Care Act, or Obamacare, it's going to go up over 30% this year. Can you imagine that? And if you're an employer trying to provide that kind of benefit, how do you take care of that? Well, my goal is to deal with that 15% that has to do with the federal government being involved in it. And as I said, the money doesn't buy care. It doesn't buy care. What it buys is it funds paperwork, it funds fees, it funds the federal bureaucracy, and the quiet price of providing obedience to a system that forgot who pays the bills. That's not health care. That's not health insurance. That's control disguised as protection. And as I said, Health and Human Services, the Department of Labor, the IRS, and CMS have layered rule upon rule to a small employer in Lima or Chillicothe. It's not oversight, it's overreach. So again, as I said, for a small employer, $50,000 a year in compliance costs, $50,000. That means it's a person that they might have hired but didn't, because that money's went to the federal government. And it could be raises, it could be a new piece of equipment, but they can't do that because they've paid that $50,000 or 10 to 15% to the federal government for just what the federal government does. And as I said, Ohio has always led with local solutions. We build hospitals, train nurses long before Washington wrote its first regulation. When care decisions stay close to home, they're faster, they're cheaper, and more humane. So this isn't about an ideology, it's about ownership. Who governs the cost of health care insurance for Ohio families? Our founders designed a balance between the federal and state authority to protect the citizens from a distant control. That's federalism, keeping governance close to the people it serves. And across the country, leaders are re-examining that balance. An Article 5 state-led convention to propose limited amendments is the constitutional tool the founders gave for us to restore this. Because when states control, not the federal government, families afford, and that's a key word, they can afford what they need. So I asked the committee to recognize the cost of this drift and have the courage to ask the constitutional question, where should the line of authority be drawn? Because freedom isn't granted by paperwork, it's protected by principles. And transparency isn't rebellion, it's leadership. So I respectfully ask you to pass House Joint Resolution 2. Thank you so much.
Thank you.